So I have what's called tenosynovial giant cell tumor diffuse, and it's very rare where I have it. Normally when you have this condition, it's in the knee, and there's a lot of swelling and a lot of pain. It just kept getting worse. Basically went undiagnosed for a couple of years. I knew there was something more going on and used to be in pharmaceuticals, and just kept advocating for myself. Went to multiple hospitals, UCSF, Stanford, MD Anderson, and felt pretty despondent with all the different methods that the doctors were going to go about it surgically. And it was my sister who lives in Towson, Maryland, who has a friend that lives here in Little Rock and is on the cancer board with Dr. Sun, and got to talking to him and set up a very close friend. Her sister's been suffering and nobody can help her. And out of the kindness of his heart, he said, "I'll have her send me her images. I'll look over them."
She came for a visit. I saw her and studied her scans, and her path report confirmed it all. Looking at the scans in her, I said, I think I could take it out without disfiguring you and hopefully not have too much trouble with your jaw joint where you could still eat and talk normally.
He was the only doctor that could do this surgery without maiming me.
The tumor Claudia had, it's called a synovial giant cell tumor. Synovium is the covering of a joint, and this is her jaw joint here, and it was involving the cover of the joint, and then it went inside the skull to where my mark is there. So this was a very aggressive tumor. It acted more like a cancer than a benign tumor. When we studied her scans, the tumor actually went through the bone inside of her skull, and that's what made it dangerous. It's very aggressive, and it was sitting right next to her brain. So the next step, if it went through bone, it was highly likely it would grow through her dura and involve her brain. In fact, she was having pain on the opposite side in her foot and leg, and that's near the area where you can feel that from the tumor, and after surgery that disappeared immediately. So it was right up against the brain. The tumor recurs quickly usually. She is now 1 year out from surgery, and our scans and exam shows that right now there's nothing that suggests recurrence. That's an excellent sign. If she goes out 2 years, there's a good chance she's cured.
The way that Dr. Sun and Dr. Day did my surgery was the best for me as far as like an outcome for not having long-term issues like a Bell's palsy, because it's in a tricky area. Dr. Sun is a saint. He's just compassionate and kind, and I know doctors are so pressured and there's so much that they have to do all at once. He has those same pressures, but he stops, he slows down, he takes time to treat each patient like they were family.